What I would like people to take away is that your voice matters. All of us have a role in increasing awareness and helping normalize seeking out mental health services. I'm Dr. Juee Phalak. I'm a child and adolescent psychiatrist, and I'm the director of behavioral health at Affinia Healthcare. I did an internship year, and during the internship year, I did some rotations in very rural Indian communities where it was very starkly evident how much the inequities in healthcare and lack of accessibility impacted entire communities. And this is what kind of inspired me to pursue a master's in public health and subsequently pursued my residency and fellowship in psychiatry and child and adolescent psychiatry before I joined Affinia.
I'm so proud to be part of the team that has nominated Dr. Phalak for this award. I'm Yvonne Buehlinger. I am the Vice President of Development and Community Relations at Affinia Healthcare and the Executive Vice President for the Affinia Healthcare Foundation. One of the things that inspired me to nominate Dr. Phalak is that right off the bat, when she started working at Affinia Healthcare, we could see that she was community-minded. She is a tremendous leader. She is passionate about her patients and to serve those most vulnerable.
I oversee behavioral health services in all 7 of our community health centers, including adult services, child and adolescent services, as well as our substance use program. On the adult side, we do more integration with primary care as a model. So we have behavioral health consultants embedded in each of the primary care clinics.
Integration of behavioral health within our system helps to reduce the stigma that patients sometimes feel in pursuing behavioral health services.
To get them when they are there at the appointment just improves access, because if you ask them to come to a different clinic on another day, that's a huge barrier. On the children's side, we have therapy services, child psychology, care coordination, speech therapy, psychiatry. We have these child development centers where we kind of offer all of those together. Access to care is still far from where it needs to be. The biggest challenge is the resources. There is a huge community need, but there is also a big gap in the need and the resources to meet that need. Looking ahead, I think we can try and address these needs by collaborating more rather than trying to do it all on our own. So sometimes using existing infrastructure, existing community leaders, also kind of trying to reach out to them in places where they wouldn't necessarily be seeking mental health care, through schools or churches or kind of more in the community, to kind of normalize seeking care.
She could be practicing somewhere else, perhaps a private practice, perhaps doing research, but she's a community-minded person, and our community has tremendous challenges. So the work that she does is really critical.
I feel very thankful to be recognized. It is also very validating. A lot of mental health work is very silent, behind the scene, unrecognized, and rewards such as these show us that it's still valued. That's just not only gratifying, but also motivating to kind of keep doing what we're doing, because even if we don't always get to see it, it does have an impact on people's lives.